Hi, I'm Sue Palmer, the Horse Physio. In Horse and Hound magazine on 6 November 2025, there was a wonderful article on caring for older horses. In it, vet Ben Chilvers, MRCVS, described the Ridden Horse Pain Ethogram, the RHPE, as one of the most significant advances in the past decade, recognises 24 subtle behaviours linked to discomfort. This tool allows much earlier recognition of discomfort, often before lameness is obvious. For the RHPE to be recognised like this, in such a respected and traditional magazine, is a landmark moment, and it's one I'm delighted to be able to talk about today. The RHPE has truly changed how we understand equine discomfort. Instead of relying on guesswork or outdated beliefs, it gives us a trusted, scientifically validated way to listen to our horses. Horses express pain long before they appear lame, and the RHPE captures those subtle signs with remarkable clarity. The tool describes 24 specific behaviours, all worded exactly as they appear in the research. These behaviours were refined and validated over years of robust, peer-reviewed studies, and that scientific foundation is why the RHPE is trusted by veterinarians, physiotherapists, coaches and horse owners around the world. One of the most important points is that it's not about any single behaviour. It's the overall pattern that matters. When 8 or more of those 24 behaviours are present during ridden work, the horse is likely experiencing musculoskeletal pain. Of course, as with all things equine, there's nuance. Some horses in pain will show fewer than 8 behaviours, and healthy horses may occasionally show 1 or 2. But the strength of the RHPE lies in recognising the pattern rather than focusing on individual signs in isolation. And at the heart of this groundbreaking work is Dr. Sue Dyson. Sue is internationally recognised as one of the most influential equine orthopaedic clinicians of our time. She spent decades as head of clinical orthopaedics at the Animal Health Trust in Newmarket and has produced hundreds of peer-reviewed research papers. Her contributions have shaped modern equine veterinary practice globally. The RHPE is one of her most transformative achievements, bringing together her decades of clinical experience and her unwavering commitments to improving horse welfare. My involvement with the RHPE began when the very first paper was published. At the time, I was already working as a chartered physiotherapist, treating both horses and humans, and I'd written 2 books, Horse Massage for Horse Owners and Understanding Horse Performance, Brain, Pain or Training. When I read the RHPE research, I immediately understood how vital it could be for everyday riders and owners. It brought science to what so many of us had observed in practice for years, that behaviour and pain are deeply connected. So I reached out to Sue Dyson. What followed was a conversation filled with mutual passion for horses, for science, and for improving understanding in the equestrian world. That shared enthusiasm grew into a collaboration, which eventually became our book, Harmonious Horsemanship. We wrote it specifically to help owners, riders, therapists and coaches use the RHPE confidently and compassionately with their own horses. It's not about turning riders into vets. It's about giving you a clearer way to recognise when something might be wrong, so you can seek professional help earlier. Early recognition supports better welfare, protects long-term soundness, and deepens the bond between horse and human. When we refer to RHPE behaviours, it's essential to use the exact wording from the research. Examples include the ears rotated back behind the vertical or flat, both or one only, for 5 or more seconds, or repeatedly laying the ears flat. Head tilted, repeated. The mouth opening and shutting repeatedly with separation of teeth for 10 or more seconds. And tail swishing large movements repeatedly up and down, side to side or circular during transitions. That precision is what protects the science and ensures that the RHPE remains a trusted tool. For older horses especially, this kind of early recognition is invaluable. Many of them are incredibly stoic. They carry years of experience in adapting and compensating for discomfort. The RHPE helps us spot those quiet signs, giving us the chance to intervene long before a small issue becomes a significant problem. I believe it's Sue Dyson's hope, as it is mine, that the RHPE becomes something every rider knows about. Not as a diagnostic tool, but as a compassionate way of understanding our horses more clearly. When we listen earlier, we support better, we make kinder choices, and we create relationships with our horses that are grounded in harmony, trust, and respect. If you'd like more reflections on this, on both horse and human well-being, you're warmly invited to join my newsletter at thehorsephysio.co.uk/newsletter. Thank you for listening, and thank you, as always, for caring about the comfort and happiness of your horse.